Okay, hey everyone. My name is Dr. Roop Banerjee. I'm a licensed acupuncturist and doctor of naturopathic medicine. And today we're going to talk about the different tools an acupuncturist might use in a typical office. So why don't we go in here and we'll look at the different types of tools an acupuncturist might be using. So, mostly acupuncture, as the name implies, acu means needle and puncture means to pierce. And so certain needles are used to do the acupuncture. Now, a lot of people have a fear of needles because of their experience with drawing blood or getting injections or shots at the hospital. And I have some demonstration examples between a acupuncture needle and a needle used to draw blood and to do injections. So why don't we look over here, and right here you can see there's three types of needles. This needle right here, as you can see, this is the needle that is used to draw blood or do injections. It's called a hypodermic needle. You can see there there's a very tip at the top of the needle, and there's actually the end of the needle is called a bevel edge, and there's actually that's designed to actually remove fluid or draw fluid. And you can see it's very stiff. If I try to move that, and that's designed so when it goes inside the body, it has an easier time to do an injection or draw blood. And it's you can't feel this, but it is very sharp and very pointy. And this is a needle, on a gauge scale. This is 21 gauge. 21 gauge is very thick needle. Now let's compare that to an acupuncture needle. So acupuncture needles they come pre-sterilized. They come 10 to a pack, and there's a guide tube. This blue thing's a guide tube, and you open up like this. You take one needle out, and the needle, as you see here, it's very thin. It's thinner than a hair strand, and it's very flexible. Now look at that, and I compare that to you compare the hypodermic needle to an acupuncture needle. In fact, the acupuncture needle is very thin. You can hardly see it. But the hypodermic is very thick, stands out, and I can barely bend that. Whereas with the acupuncture, look at that. You can bend it, and it goes back. Whereas this, you can't. This is very sharp. This is actually called a solid filiform, while this is called a hypodermic needle. And this is the needle that I would use on body acupuncture point. So, for example, let's say someone has a headache on their top of their head or the side of the head, or maybe they're having allergies. So I would put the needle like this in the guide tube. I would hold it there, and there's a point here. It's called large intestine 4, and I would just put the needle like this, and I would just tap it in, and it go like that. So this is actually 1-inch needle, but it probably went in maybe 1/4 of an inch. And as far as pain, there's virtually little pain, maybe a little ache for some patients, and then it would stay in there for about 20-25 minutes. Let me show you the other type of needle used in acupuncture. This is called a 1/2-inch needle. The gauge on this needle is the 38, and the gauge on the other acupuncture needle was a 38, whereas the gauge on the hypodermic needle was a 21. So the higher the gauge number, the thinner the needle is. Now I'm going to open this up. This is called 1/2-inch. You can see here it's very thin. This is 1/2-inch, very flexible and soft, just like the 1-inch needle is. Super thin. And this type of needle can be used on the body, but it's mainly used on structures like the ear. It may be used in someone who's very thin and frail. But we'll do a demo. So this is just a practice ear, and there's this point here on this area of the ear is called the triangular fossa, and there's a point right here where it's used for calming the mind and helping with stress, anxiety. It's called Shen Men, and I would clean the ear first with rubbing alcohol, because the ear is very thin, has very cartilage, not a good blood supply. And I would put the needle and the guide tube like this, and then just press down like that. So that's ear acupuncture, and those are half-inch needles used in the ear. So we talk about needle methods for acupuncture point stimulation. What about some non-needle methods? Now, some patients or people may just not be like any needles, regardless of the fact that they're very thin. So there's other ways. One is using a laser. Now, when we talk about lasers, most people think about a laser used for eye surgery or in just general surgery in the hospital. And that type of laser is called a hot laser. A hot laser creates heat, and it's used to like burn tissue. Whereas a cold laser, that type of laser, does not generate heat. It's actually very, it does not generate any thermal energy inside the body. And essentially, if there's a certain part of the body that needs stimulation, I would just turn this button on and then shine the laser to a particular part of the body like this. But this does not generate heat, and you can't really see it. I mean, if the light was dark, maybe you would be able to see light. But this is actually invisible light. It's called the infrared zone, and this is very good for pain. Yeah, and oh, you can't see it here. Just see a little red light, if anything. But this is good for pain, neuropathies. In some clinics, I've used this for stop smoking, and for people who are just very sensitive to needles. Okay, so then another way to do needle acupuncture point stimulation is using this type of machine here. This is called a microcurrent electrical point stimulator, and what it is it's a way to, this machine can detect acupuncture points and then stimulate the point with a very small different current. As you can see here on the screen, there's different frequencies for different tissues. So 5 hertz is for like organs, bladder, small intestine, large intestine. 10 hertz is for muscles and bones. 20 hertz is for endocrine glands. 80 and 160 is for neurological issues. 40 is for the spinal cord. So depending on what part of the body you're working on, different frequencies are used. And then this over here, if you look under here, there is a different energy output in microamps, just 10, 20, all the way up to 150. So this is probably the ideal way to do acupuncture, especially on the ear, if someone's very, very sensitive to needles. So let me just show you how this would work. So I would turn this on. Let me just take all the wires out. Turn on like this. Makes a certain noise. And make sure that it's balanced on 0. And that I would have the patient hold this element, this grounding pole. Alright, I'll hold it. And what I'll do is I would go in my ear, let's say it's some patient's ear, and wherever there's a, if you look on the screen here, if you look on the screen, wherever the needle drops really high or very low, let's see here, that would be an active point, so like right there where it went to 2, and then I would stimulate the point, the small little current, for about 8 to 16 seconds. And that's it. So these are several ways to do acupuncture. 1 with needles, 1 without, and then 2 without needles. The laser and then the microcurrent electrical stimulation. And as you can see, acupuncture needles are much thinner than regular needles, and so there really isn't much to fear about. Still, for those who have a fear of needles, there are non-needle methods such as microcurrent stimulation and the laser stimulation. So for more questions, or if you have more questions and you want to get more answers about acupuncture,